So if you've been living with chronic pelvic pain, you know just how frustrating the search for answers can be. It's this really personal, often totally invisible struggle. We're going to dive into a condition that gets overlooked all the time and explore a modern solution that actually gets right to the root of the problem.
Does this sound familiar to you? That dull, aching feeling that just seems to build and build as the day goes on? Maybe you start your morning feeling okay, but by the evening, that pressure and that ache are pretty much constant. Well, this specific pattern is a huge clue, and we're about to unpack what it means.
This is a story we hear constantly, and it is so disheartening. You go through countless exams, you see different doctors, only to be told that, well, everything looks normal. It can be incredibly invalidating, but it absolutely doesn't mean your pain isn't real. It just means the cause might be hidden where traditional scans can't find it.
All right, so let's get really specific about this, because understanding the character of your pain, what it feels like, and when it happens, is the crucial first step toward finding the right diagnosis and, more importantly, the right treatment.
Just look at how consistent these patterns are. If you find yourself avoiding being on your feet because you know it's going to make the pain worse, or if lying down is the only thing that brings you any relief, you are not alone. These aren't just random symptoms. They all point to a very specific underlying issue.
Okay, so if it's not showing up on all those routine exams, what is actually causing this persistent, disruptive pain? Well, the answer lies deep within the venous system in your pelvis. The medical term for this is pelvic congestion syndrome, and what that really means is this. The tiny valves inside your pelvic veins, the ones that are supposed to push blood back up towards the heart, they've become weak. So blood starts to pool, it flows backwards, stretching the vein walls and creating this constant, heavy, aching pressure. It's really a plumbing problem, not an organ problem, which is exactly why it's so often missed.
Honestly, this is the simplest way to think about it. We all know what varicose veins look like on someone's legs. Now just imagine that same exact issue happening with the veins deep inside your pelvis. You can't see them, of course, but you can definitely feel the pressure and the pain that they cause.
For a long time, treatments for this kind of pelvic pain just didn't address the underlying vein issue at all. They really only focused on managing the symptoms, which, as many of you probably know, is often a losing battle.
Think about it. Traditional approaches like pain medication or hormone treatments are really just putting a Band-Aid on the problem. They don't fix the faulty veins. Even a major surgery like a hysterectomy often doesn't solve the issue if the pain is actually coming from the veins. Embolization, on the other hand, is completely different. It's designed specifically to fix the source.
This brings us to a modern, incredibly targeted procedure that directly addresses those problematic veins. It's called pelvic congestion embolization.
So let's look at why this approach is such a game changer. It is minimally invasive, so it is not open surgery. It's an outpatient procedure, which means you go home the very same day. There are no stitches, just a tiny pinhole access point. It's all done with incredible image-guided precision. And most importantly, it treats the source, not just the symptoms. And it preserves your uterus and normal anatomy.
Okay, so you're probably wondering, how do they actually do that? The process is remarkably straightforward and precise, and it all uses advanced imaging to guide every single step.
Here's the breakdown. While you're lightly sedated and comfortable, a specialist makes a tiny pinhole entry. Then, using a live X-ray, kind of like a GPS, they guide a catheter, which is thinner than a piece of spaghetti, directly to the faulty pelvic veins. Next, they use tiny soft coils to block off those enlarged veins for good. And instantly, your body is smart. It reroutes the blood flow through all the other nearby healthy veins that have been working correctly this whole time. It's that precise.
So understanding the solution is one thing, but knowing what to expect afterwards, well, that's just as important. Let's talk about what recovery looks like and how you can figure out if this is the right path for you.
The recovery is typically really quick. You'll go home the same day and just take it easy. Most people are back to their normal, light activities within a day or two. You might feel some mild cramping for a few days, but the really significant relief develops over the next few weeks and months as your body adjusts and that chronic pressure finally starts to fade away.
So how do you know if you should maybe explore this? Take a look at this list. If you've been living with that classic aching pain for over 6 months, if it always gets worse when you're on your feet, and especially if you've been dismissed without a clear diagnosis, you really do owe it to yourself to investigate this as a possibility. You know, after years of searching, the answer could be a minimally invasive procedure that treats the true source of your pain. The next step is really just a simple conversation with a specialist who understands this condition inside and out. At IR centers, our interventional radiologists specialize in these advanced procedures, like pelvic congestion embolization. Because every patient's situation is unique, the absolute best next step is to have a dedicated consultation to see if this is finally the answer you've been looking for.
So